All right, thank you for staying with the Monday Report. Town Hall session begins right now. Tonight, we're going to have a very candid conversation on how COVID-19 has affected different people and their mental health. According to the World Health Organization, COVID-19 pandemic has triggered a 25% increase in prevalence of anxiety and depression world over. So tonight we're going to have a bit of conversation from people who've experienced it one way or another, how they've dealt with it. And we're going to answer just two fundamental questions. How can I tell my mental health is being or has been affected? And how do I deal with it? Those two questions. At Trevor Mbija at Citizen TV Kenya, use the hashtag Monday Report. Let me introduce my guest really quick. From the farthest left, Dr. Catherine Gitau, a consultant psychiatrist. Thank you so much for making time for us. She's a consultant psychiatrist at Aga Khan University Hospital. Next to me is Dr. Angela Migoa, a pediatric rheumatologist at the Aga Khan University Hospital, dealing a lot with children as well. Thank you so much for making time. Let's get straight into this conversation and hear from the people themselves. How has COVID-19 affected them and how have they dealt with it? Right over there. Ma'am, please start with your name and then get into the conversation.
My name is Elizabeth Washira, an event organizer at Daily Solutions, that is a family business venture. Well, I can say that COVID-19 came with a positive and negative side effects. And I can say that I was affected in one way or the other. And being in that event industry, we remember very well that there was no gathering. So my business was very affected. And I was traumatized. I was mentally affected. But I remember very well when our former president said that it is time now to keep for ourselves the food, that is. I remember instead of keeping food for myself and my family, I invested the cereal shop. To now it's working very well, so I can say that I got new ideas through the challenge, or rather the COVID-19.
Okay.
So I can say that, okay, right now the event, it's doing very well, but I say that I cannot leave the cereal shop because it has sustained my family. To now it's doing very well, and I thank God for that.
All right.
Thank you.
Brilliant. So you found a way of coping.
Exactly. I got new ideas.
All right.
Yeah.
Brilliant. Please pass the microphone next to you. Yes, go ahead. Start with your name, please.
My name is Mary Wafula Omolo. I'm a mental health champion with Basic Needs, Basic Rights Kenya. I'm also a mother and an artist. So during the COVID-19, I was affected mentally because I got my child during the COVID season. I underwent something we call postpartum depression because of the so many challenges. I am an artist, and we could not even afford to go out to perform. And also, given that I have a child at home, I have so many things in my mind, and there is no income. So with that, I had a lot, and it affected me. My coping mechanism was I had a support system. These are family members and friends who were there for me, and they helped me to find my path again.
Okay.
Hi, my name is Sharon Murugi. I am a student psychologist as well as a mental health champion. And COVID-19 was a bit of both, so both positive and negative effects. So it started out, the fact that we were, closed off and, there was no community. It really affected me because, there's no support system. Like literally my mother was like in another county and I could not access her, and it really affected me. Like my anxiety went through the roof. But, in due time, we embraced technology and, while embracing technology, I also learned new skills. So in that moment, I learned new skills, and that's currently where I am working. So I'd say it has both positive and negative effects. What helped me was, getting a routine. I also started seeing a therapist, which has been helping for some time now, yeah.
Okay. All right, so you can pass the microphone to the front. I'll come to this line in just a bit. But Dr. Gitau, let me start with you. There are two main issues that I've had here. One is family and distance from Sharon, and the other one is more about loss of income. And Elizabeth also mentioned it, but also to her advantage, she also got more income eventually. But then how do you tell that you're affected mentally, and how do you cope? Because it manifests differently for different people. For Elizabeth, she found a way of coping and even made more money. For her, she did not. And for her, for Sharon, the issue was the distance with family. So how do you know that you're dealing with a mental issue on your own, first of all?
Okay, thank you for this opportunity once again. And I'm really glad that today we are hearing real-life experiences and people are sharing exactly what they went through. And from what I have heard, each person has shared how they coped with it, with the COVID-19 and the effects that it had on them. So I've had anxiety mentioned, I've had postpartum depression, and I've had some form of psychological distress. So just right there, we see that different people suffered different effects because of the COVID-19. So the symptoms of mental illness are different. But then once, for example, Elizabeth mentioned she was very distressed at the time, yeah? So once you mention the word distress, meaning that you're having a sense of being overwhelmed by the current circumstances. You know, something has suddenly changed, and therefore you feel that your normal coping mechanisms are exhausted. So you feel you're really not able to get back on your feet immediately like you would if it was just a small stressor going on. So there's this sense of being overwhelmed, and then followed by now feelings of maybe anxiety, feelings of low mood, feelings that probably I don't want to do what I normally do on a day-to-day basis. I don't want to interact with people. So manifestations can be very different. So for some people, they will manifest with the anxiety disorders and probably now start feeling they are worrying excessively. You know, with anxiety, there's a tendency to think about things that have not yet happened and keep worrying and worrying and worrying about it, yeah? So that tendency to feel that you're not able to control the worrying thoughts, that's already showing that there's a problem, yeah? And then once these worrying thoughts come, if you try the normal coping mechanisms, maybe if you take a walk, maybe if you listen to music, all that is not helping. That means then it's more of a mental illness. It's not just the usual, you know, that, yeah, I'm anxious today, and once I do 1, 2, 3, I feel better, yeah? So that is what would indicate that, yeah, there's a disorder, because then you're not able to go back to your normal functioning, and the quality of your life is also interfered with. So that would be what I would use to talk of now. There's a mental disorder. Okay. Now, once there is a mental illness or a mental health issue, the coping mechanisms they talked about, the sense of connectedness is really important. I had my sister here talking about having her family support her during the postpartum period. So that sense of connectedness, which was lacking in COVID-19 because we had the social distancing and all these other things, that the lockdowns and all those. So those would take away that sense of I'm connected and I belong. Yeah. So that in itself is a way of coping. Then now, you know, practicing some hobbies. I saw some people starting to exercise during COVID-19, taking walks in a park. You know, that at least you could do with a few friends walking, yeah? Okay. So a few things that you would normally do that cheer you up, then try those when you're feeling distressed. But when you feel it's now extreme, it's going beyond, and I'm doing these things and I'm still not feeling okay, then there you need to seek professional help. And Dr. Migo, at what point does it become an emergency? Because she mentioned postpartum depression.
a child is supposed to be a bundle of joy. But when you're getting a child under a situation where it's considered a bit stressful, at what point do you know that this is the normal stress that a newborn brings? And at what point do you now know this is postpartum depression?
So thank you once again, Mr. Mbija, to you and the team for hosting us, and to our audience for their good questions and comments. The reality is, even without the pandemic, a significant number of ladies are at risk of postpartum depression. Of course, many things in your environment can trigger you, okay? But I just want to build upon what Dr. W.H.O said. When you're not able to continue with your activities of daily living, right? Like feeding yourself, feeding your baby, cleaning yourself, cleaning your baby, right? When you find that your interactions with the other people in the household are being jeopardized. As Dr. W.H.O said also, you know, our social networks are really important for us. So when you find yourself not being able to maintain those social networks, I would say those are the two things that would be a red flag for you to know that it is important to reach out for help. And, you know, with mental health matters, I think the challenge, well, we are overcoming it, but I think the challenge we face is that it's still really stigmatized. And I really commend our sisters here because there are certain underlying themes the three ladies have shared. The first is that they acknowledge that they had a problem, right? And the second important thing that these three wonderful ladies did, they focused on what they could control, yeah? And so, you know, acknowledging that there's a problem, as per the science that I've discussed, you can't maintain your activities of daily living, your social interactions are compromised. That is the first step. Then the second step is trying to focus on what you can control. Most of the time we can control our feelings. What happens external to us, most of the time we cannot control. And once you acknowledge that, then the next important step is to reach out for help. Because, you know, when you're having these challenges, trying to resolve them on your own would be more detrimental than beneficial.
Okay.
Yeah.
There's a microphone back there. Kindly, yes, start with your name and just state how you've dealt with it and what you've seen with time.
Okay, good evening.
Good evening.
My name is Warieme Karinge. I'm founder and CEO of a mental health organization called Let's Go Mental Kenya. I suffer from depression and anxiety disorder. Now, my question for you today would be, I've found that, you know, when COVID came, like there was a lot of fear of this condition. So if you feel a chest pain, you're like, could that be COVID? If you feel a headache, could that be COVID? So I found that even after COVID was over, I'm still very worried about other conditions. So every small thing, I'm like, could that be? Why am I feeling pain in my stomach? So it's like, since COVID began, it gave me anxiety, which I'm being given right now, as you can see. But yeah, maybe you can just help me with that question.
Yeah. Let's pause there for a bit as you pass the microphone. How do you deal with it? And I think she's pretty brave to actually even talk about it on live TV. But how do you deal with anxiety, and how does it manifest, and how do you calm it down?
I think I want us to go back into history. You know, history repeats itself. And if you speak to we call them epidemiologists, people who use mathematical models to help predict disease occurrence and things like that, they say that the next pandemic will come. The only question is when, all right? And when you go back into the history of mankind, like in the 4th century when they had what they call the Black Plague, right? Again, people were overwhelmed with fear and anxiety, right? Again, I think it was in the 14th, 15th century again, there was another plague. Again, people were overwhelmed with fear and anxiety. Then I think in the early 19th century, there was the cholera pandemic. Again, people were overwhelmed with fear and anxiety. And in this instance, in particular, they blamed immigrants because they say that trade led to the rapid spread of the pandemic at that time. So people tended to blame immigrants and traders for spreading that plague. So the issue of fear and anxiety in such unpredictable times is not unique to what we are experiencing. I think that's the first important step, so that we are not too hard on ourselves for feeling like that. I think that's really important. The second thing is, as I said earlier, reach out for help. Don't try and fix everything on your own. There are people who can assist. The third important principle, Mr. Mbija, is create a routine. Create a routine for yourself. You know, waking up at a certain time, maybe you do exercises at a certain time, you have your meals at a certain time. What that does, it takes away any time block of being idle, right? Because then when you're idle, you become preoccupied with some of these thoughts. That I think my back is hurting a little bit more than usual. Or, you know, if you are admitted in ICU and you needed oxygen, you're in a room like this, but you just feel like you can't breathe. So the power about creating a routine is that your mind is now engaged in activities. So you're not so preoccupied with thinking about the negative effects you have gone through.
Okay.
So this is in the backdrop of seeking out help from a qualified healthcare provider, helping you to navigate these feelings of fear, anxiety, and loss of control.
Okay. Dr. Gitau, what Dr. Migoa is raising is quite important on how you deal with anxiety, because there are also different categories. So there's dealing with the loss of livelihood. For example, your initial routine was to wake up in the morning, go to work. Now that work is not there. So do you need to form a new routine? If you're bereaved, for example, you lost a loved one with COVID-19, there's someone your routine was to wake up and talk to. Now, do you form a new routine? How do you deal with it?
Okay. Yeah, that's really important. In terms of once you've lost routine, in terms of used to wake up every morning and go to work, then I think first thing, forming a routine within what you have at home is key. In terms of, I will wake up a certain time, as Dr. Migoa has said, you know, and do 1, 2, 3 through the day. As she said, that gives you some structure, and that takes away, you know, idle time, to put it that way. And as she was talking about how to deal with anxiety, there's something also that came up, or I came across during the COVID-19 pandemic, where we were saying within your routine of the day, also create a problem-solving window in your routine. So that during this problem-solving window or time, you're deliberately putting aside 1 hour or 30 minutes when you're thinking about the things that keep worrying you, or keep, you know, because you're saying in anxiety, you're having a loss of control in terms of the worries. So what are these things that keep worrying me in the day? Write them down. Why are you writing them down? So that you can come up with a strategy. Is it this problem? What can I do about it? If it's something I cannot do anything about, who can help me do something about it? So that you're taking it from a worry to something that now is a plan and something you can follow up on, and it's on paper, ready. So that is a technique of getting rid of worries. Now, you also asked me about, loss of livelihood, loss of job. Jobs also give us a sense of belonging, you know, and a sense of being needed, which is what human beings, I think, we thrive on. So that loss of belonging, that loss of I belong somewhere, I do certain things to make people happy, then what can I replace that with? So that at least I am belonging to a certain group. Should I now go live with my family, at least have some sense of I'm not all alone, you know? Much as you're coming up with a new routine, what can give you that sense of I'm connected and I belong? Okay. And then now exploring what talents do I have that I can do 1, 2, 3 that will help me feel that I'm doing something and adding value to society. Like my sister mentioned, yeah, she started selling cereals, yeah? So what else can I do apart from, this career that I've been used to having maybe most of your adult life? Apart from that, can I explore my talents and try and do something with that? Right. So that also helps you at least get engaged. Okay. So if you're someone who likes knitting, if you just start knitting up something, you might not sell it, but at least you feel you're productively engaged. Okay. Yeah.
All right, the microphone is still back there, and then I'll come to the front line. Continue your comment or question. Start with your name, sir.
Good evening. Good evening.
Good evening.
My name is Duncan. I'm a pastor with Gospel Recovery Spring, Elevators Chapel. When talking about COVID, after COVID, so many things happened, especially to us pastors, because people were used to meeting together, socializing. So when that stopped, I came to realize that when everybody went his way and you are at your own corner, when problem came, the only person they could consult was a pastor. So we are overwhelmed with counseling. Sometimes you don't even know what to do. And the big issue comes in when especially it goes all the way to mental health. You find somebody is sick mentally, and the first person they'll come to is a pastor. My question has always been, at what time do I refer this person to an expert, especially when it comes to healthy issues? Because there is that which we can do counseling, we can talk and sort things out. There is that thing that I can tell you here, maybe it is businesses, you are supposed to do 1, 2, 3 things. But sometimes people come and they're totally sick, and you see this person actually need help. How do we connect with the medics so that you can be able to help our people before the issue deteriorates?
Okay.
That is my question.
All right. I'll come to the front. Dr. Gitau, answer that question first. At what point does a religious leader realize that this one now needs an expert?
Okay.
And how do they get in touch?
All right. Thank you very much for the work that you as pastors did. W.H.O had come up with something called psychological first aid. And I think that was a good place for religious leaders and the community healthcare workers to start in terms of providing psychological support for the people within the community. So within that psychological first aid, there is what we say are warning signs, which now tell you that at this point, this person needs referral. Like if you're dealing with somebody who is just psychologically distressed and probably is presenting with, anxiety symptoms, but they're not severe enough to stop them from functioning, you can help them in terms of, okay, is it that they lack food? Is it that they are about to be kicked out of their house? Just guiding them in terms of, now, what are the next steps, at least, for me, at least to feel my mind is at peace. Then after that, if this person is still distressed, then you know that you have addressed their initial problem, which is probably housing or food. And then after that, if they're still psychologically distressed or anxious, depressed, then that is when you reach out to a healthcare worker. I would advise that you refer them to the nearest health facility to you. If that is not possible, then you reach out now to probably, like Red Cross was also offering some psychological support as well, and they have referral channels, So just looking for the best option in terms of where you are at, where you're located, So if you can start with the health facility near you, that would be best. And just ensuring that you take them there, I think that is a first step. Because then if you just tell them you go, they might not actually get to the health facility. Because somebody who has hallucinations, who are, hearing voices, and they're not there, the person who they're hearing voices talking to them is not there, that one is an indicator there's a bigger problem beyond what you can solve. Somebody who is having suicidal thoughts and intent, that one, you know that this one definitely, that's a warning sign. I need to take them to be seen by a healthcare professional. And in most of the cases, in every healthcare facility, there'll be at least somebody who can give you direction as to the next steps. Yeah. Okay. I think that would be the best place to start.
All right, Dr. Migoa, your thoughts on what Pastor Duncan is raising?
Thank you, Pastor Duncan, for your question, and again to celebrate you and all our religious leaders for the spiritual support they offer the Wananchi. Like I said earlier, it's important to go back into history and see the role that people like you have played. Whether it was the Black Plague in the 4th century AD, that came back again in the 14th century, and the cholera pandemic in the 19th century. The citizens at the time, as we also saw during the pandemic, there was a significant proportion that felt that this was a consequence of the wrongdoings that we have done. Okay? Now, as part of the medical ethical pillar of autonomy, it is not my place as a healthcare provider to judge you for having that perception, all right? And if you're going to help this individual overcome the pandemic, you have to address that aspect, which you spiritual leaders are better at doing than us in health, okay? That's the first one. The other really important thing that we see in those 3 pandemics, which we also saw in the COVID pandemic, is that the citizenry, not just in our country, but across the globe, trusted the spiritual leaders more than the healthcare providers and the government officials. And these are things that, if you read history, it's the same thing that happened, okay? And you see, the human person is not just the physical body, right? We have a mind, we have a soul, and we have a heart, right? The heart is believed to be the seat of emotions, the mind, the seat of our thoughts, and the soul, the seat of our spirituality, all right? So even in the management of these patients, it doesn't mean that first take care of the mind, then take care of the body, then take care of the soul. These things can happen in tandem. And it's the essence of multidisciplinary care. It's the essence of integrated healthcare, because the human person is all those aspects combined. So what I would advise is, as you continue helping to nurture their spiritual side, they can also be seen, the psychologists, the psychiatrists, to deal with their depression and anxiety. You know, if they need someone to help them to socially cope, that can also happen concurrently.
Okay.
Yeah.
All right, let me get that quick comment before I take a break. Yes, you have the microphone before I come here.
Good evening, guys. My name is Edgar Odhiambo. I'm a policy analyst and mental health advocate as well. During the pandemic, one big thing that kept coming up, there are a lot of guys who are experiencing now like anxiety, depression. Mostly, a lot of guys are experiencing these things for the first time. Now, one big thing that kept coming up was maybe if like a friend reached out to me concerning a loved one who was going through, either anxiety or depression. The big thing that kept coming up was, how do you support? How do you offer support to these guys without just saying, I'm here for you, I love you, I care for you, but what other ways can you actively support these guys who are in distress, going through a lot, whether it's loss of livelihood, it could be the postpartum depression that has been talked about today, and any other, maybe it could even be family issues, for example. So that would be my question for today.
Okay. I have to take a quick break. When you come back, we deal with that. Is there a structured way of offering support when somebody has lost their livelihood, somebody has lost a loved one? Is there a structured way, despite what Edward is saying, instead of just saying everything is going to be fine? Is there a structured way of dealing with this? But that is coming up right after the break. I also see some of your concerns at Trevor Mbidi at Citizen TV Kenya using the hashtag Monday Report. Taking a quick break on the town hall. When we come back, we're still having that conversation here. And special thanks to the European Union, the Aga Khan Foundation, and the Aga Khan Hospital for enabling this conversation to take place. All right, we're back in just a bit with this town hall session. All right, see you shortly.